everyone, and welcome to the third hosting of the Caribbean Pre-Conference to the Health Systems Global Conference or Symposium, which is again being hosted in collaboration with Health Systems Global and the Pan American Health Organization. I welcome you on behalf of the co-hosts, which include the University of the West Indies, the UWI, including the Caribbean Center for Health Systems Research and Development, as well as the Georgia Lane Chronic Disease Research Center, as well as other co-hosts include the Caribbean Community of Practice for Health Policy and Systems Research, the St. George's University, and the University of Guyana, and of course the Planetary Health Alliance, the Caribbean Hub. So welcome to one and all to this exciting pre-conference. Of course, special thanks to Drs. Danielle Maceira and Noelia Cabrera, who are with the Health Systems Global Latin American and Caribbean Hub. And of course, they did all the planning. Importantly, this year will be the 7th hosting of the Health Systems Global Symposium, and the first time it will be held in Latin America and the Caribbean. So it's important that we from the Caribbean have a good showing at this symposium, which will be held at the end of October, early November. We'll get more details on that from Daniel. But of course, we are meeting today to review papers that were submitted for the pre-conference with the aim of reviewing, giving feedback to strengthen those papers that could be then presented or submitted for presentation at the Global Symposium. We sent out a call for abstracts and we got 17 that were submitted. And of course, thanks to all of the persons who were involved in the scoring of the abstracts, including Dr. Damian Graves from St. George's University. And of course, we really are pleased to note that 12 papers were selected for presentation today. So there'll be 3 sessions, each of 4 papers, 4 excellent papers were actually selected. And they include papers submitted from regional universities, from the UWI, University of the West Indies, the campuses, the St. Augustine, Keifel, and Mona campuses, University of Guyana, and the St. George's University. Importantly, we have papers submitted from health authorities within the Caribbean, and I liked where there were a couple of papers where there was a nice collaboration between the academia and the health institution. So that I think was excellent. There were 5 papers, or there will be 5 presentations on COVID, but really, which is very topical, but of course there's a range of issues being addressed today, including climate change, planetary health, chronic diseases, and so on. So I won't go into all of the papers now. So I think I can end my welcome now and hand over to Dr. Danielle Maceira, who is the representative on the executive of Health Systems Global for Latin America and the Caribbean. So Danielle.
Thank you, Donald. Thanks everybody to be here today. I'm very happy to present the third cycle of pre-conferences in Latin America and the Caribbean for Health Systems Global, and being part of the board of Health Systems Global for almost 5 years so far. And I'm being honored with the chair for the Americas. And this is the reason why we have been organizing this series of events in preparations of our global symposium. As Donald just said, this is the first time in the history of Health Systems Global that we will organize our global event in Latin America and the Caribbean. And it's gonna be, it will take place in Bogota, Colombia in October, November this year. And that's why this is a special occasion where we can discuss the production of the region, receive comments and suggestions to enrich and improve the abstracts and the document, and have a more competitive regional perspective at the moment of sending out our material to the call for abstracts. We have two deadlines at the global level. The first one is in mid-February, when we have the call for organizations, and the second one is in mid-April, where it closes the call for individual abstracts. So all the production that we will discuss in today, and those papers that were not being able to be discussed also, can be refined and submitted to either the organizations or the individual abstract session call by mid-April this year. So, well, something about Health Systems Global. Health Systems Global is the international society devoted to study health systems, and the idea is to put together policymakers, researchers, and people working in the civil society institutions to organize, discuss, and trying to share views about how healthcare systems are going and what are the needs for improve their efficiency, their equity, and its reach. Particularly during these last 2 years, health systems have been challenged and because of the COVID pandemic, and we need as researchers, policymakers, and advocates to find a way of provide better health and identify what are the strengths and the weaknesses that the COVID has shown to us. Our general call, global call, is about that. Is trying to identify how, when health systems become key part of the political agenda, how systems adjusted to that. And we have 4 sub-themes that are related to the politics and the policies of health system performance, the organization of healthcare system networks and human resources, the identification of needs and the approach to equity. And finally, we are trying to identify different ways of health systems organizations and how to monitor and evaluate the performance of those systems. During this pre-conference in the Caribbean, we will have 3 sessions, 2 during the morning and 1 afternoon. And we're trying to summarize what are the key research and policy implementation documents that were received by the society. And I'm going to be chairing the first session, Donald, the second, and Damien will be chairing the last one during the afternoon. So the mechanics of the event is we will have 15 minutes for each paper to be presented. We will try to be very tight about the timelines in order to reduce calendar issues. And then after the 4 presentations of each panel, we will go to questions and answers. And I will appreciate you can incorporate your suggestions and comments in the chat. So each moderator will be able to read them and then receive the feedback from the authors. So thank you, Donald. Thank you, Damien, and the rest of the Caribbean team for their support and the protagonism of the Caribbean in the identification of issues to be researched and advocate for.